Now we're on to the three symptoms of low back pain, and as I said, this is going to be quite a sort of a logical and progressive way of getting lower back pain. There are more, but this is a very common route that people tend to take when it comes to low back pain. So on this screen, we've got the first two symptoms, which is non-specific low back pain and back spasms. Now, non-specific low back pain is not attributed to any recognizable pathology. So it could be a dull ache, a sore back, pain around the hips. Now, you may identify that as being when you're sat in a car for say 2 to 3 hours and your hips start to ache or your back starts to ache. You're stood up for a long period of time in a queue or in a crowd, and again you'll start to get an ache or a pain in the hips or the lower back. That type of low back pain is not what they know as a non-specific. Now it says that there's no recognizable pathology. There is, it's just a very general one that needs to be investigated a little bit further. And what we talked about with regards to posture will be a part of that non-specific low back pain. So if we have incorrect postures, if we overuse and misuse our body, that can create joint stiffness. So our joints can become tight, which creates muscular imbalances and so on and so forth. Obviously, that's going to create a lower back pain. And that is what the majority of people will experience during their life, I guess, or their low back pain career, as it were. So we have to understand that there is a cause of non-specific low back pain. It's just the majority of professionals aren't maybe exploring the cause maybe as thoroughly as maybe they could. So if I can then just bring you onto the little graph on the right hand side, hopefully you can see here we've got a graph which has got sort of men stood or people stood or a person stood on the top of it. Now this is a diagram of something called intradiscal pressure. So the amount of pressure on the discs in different postures. And as you can see, the lowest one is someone lying down on their back. It increases as you move on to your side. Then it increases again as you stand up straight. It increases again as you stand up and bend over forwards. It increases again if you stand up, bend over forwards whilst lifting or holding something. The next one is being in a seated position. Now, being in a seated position is just as bad as standing up and bending over, as you can see on the graph. If we are then sat down and bending over, it increases again. The worst posture to be in is being sat down, hunched over, and lifting something from the floor. Now, all of those postures create pressure on the back. We can't, in a way, get rid of the pressure. As you can see, being led down on your back is the least amount of pressure. So we can't eliminate it, but we can certainly manage it and help ourselves reduce and overcome low back pain by being in different postures, but also being in those different postures correctly and using that body correctly. Going back to the non-specific low back pain, the non-specific low back pain is like the first step towards low back pain. Now, non-specific low back pain is the type of pain that people will work through. They will exercise through it. They will put up with it. It won't necessarily hold them back. But what non-specific low back pain is, it's our body's first warning sign that something's not right. And if we work through it, if we exercise through it, if we just trudge on through it and put up with it, then eventually it's going to progress. And normally what can happen is it can progress onto a back spasm, which is a spontaneous abnormal contraction of a muscle. Now again, most people will think that spontaneous abnormal contraction of a muscle is there's something wrong with my body. But what that spontaneous abnormal contraction of a muscle is your body protecting the spine from further damage. because the muscles are becoming that fatigued and that, or the spine is becoming that vulnerable that the muscles have to lock up and contract around it to protect it. So you may experience this from picking a pen up off the floor, or lifting incorrectly, or just doing a really menial task and then all of a sudden your back locks. That would be a back spasm. And again, the body's been giving us these warning signs of a non-specific low back pain, a dull ache, a sore back, pain around the hips. If we don't treat those symptoms, or if we don't manage those symptoms, it will then progress on to a back spasm. If we then continue on, it will move on to what we're going to talk about on the next slide. And that's kind of how we have to think of low back pain. It's a progressive injury, and it is treatable, it is reversible, but most of all, it's preventable. And it's preventable by using your body correctly. And going back to what we talked about in posture, in static and dynamic postures, is using your body correctly, so not overusing it and not misusing it, but it's using it correctly so we can reduce the pressure on the different joints of the body so the pain doesn't manifest itself. So the first two symptoms, non-specific low back pain, that's the dull ache, the sore back, the pain around the hips, is the type of pain that people will just live with, if you know what I mean. Then we start to get back spasms. That'll put you out for a few hours, maybe a couple of days. The non-specific low back pain may put you out for just a couple of minutes, and then you get back in the car and you continue on. But the back spasm will put you out for a little longer. What we're going to talk about next is a herniated or a bulging disc. Now again, this is sort of the next progression on.